Good morning, friends. This is Dr. Vishal hansrajani, Associate Professor, ENT Department, Index Medical College. So today's topic of today's lecture is anatomy of the ear. Uh, as we all know, there are the main four components of the hearing mechanism. That is the outer ear, the middle ear, and the inner ear. And after that, there is the central auditory nervous system. So, if you want to hear normal, then we all should have all these four components to be normal. So, it is the line diagram. Here we can see all the three parts of the ear. So, we'll start with the anatomy of the external ear. So, external ear is divided into the auricle or the pinna, the external auditory canal, and the tympanic membrane. Now we come to the auricle. The auricle is made up of elastic fibrocartilage. It has got two surfaces. One is the medial and a lateral surface. The lateral surface is characterized by the many prominences and depressions. So the important landmarks are: one is the helix. It is the most prominent outer part of the pinna. The anti-helix, this is the fold in front of the helix. The concha, it is in front of the anti-helix, and it is a hollow space which divided by the crux of helix into the cymba conchae and the cavum conchae. Another important part is the tragus. It is the most interior most part of the pinna. It is the cartilaginous projection interior to the cavum conchae. The scaphoid fossa, it is the boat-shaped space between the upper part of the helix and the antihelix. Now, the incisular terminalis. This is the space between the helix and the tragus. Clinically, this incisura terminalis is very important as this area, the site is deficient of the cartilage. And as we all know that this pinna is made up of the single elastic fibrocartilage. So whenever we want to give an incision over the pinna in cases of the end oral approach of the ear surgery, we incise in the incisura terminalis by which we prevent any cut over the pinna cartilage. And in that way we avoid the complications of perichondritis. The cartilage is avascular structure and derives nutrients from the perichondrium. So, if there is a trauma over the cartilage and there is a bleeding in the subperichondrial layer, so this way there will be a hematoma in the subperichondrial layer and it will reduce or hamper the blood supply or the nutrient supply of the cartilage. So if there will be a necrosis of the pinna of particular that part, and this we call it as a boxer's ear. There will be deformed pinna because usually boxers they got a multiple injuries over the pinna and they develop a deformed pinna. There are two ligaments attached to the this thing, the anterior ligament and the posterior ligament. The muscles, there are many extrinsic muscles in the pinna. The auricular is anterior auricular is posterior, and the auricular is superior. But mostly they are vestigial in the human beings. And there are some interesting muscles also. If we talk about the blood supply of the pinna, it is the posterior auricular artery, the anterior auricular branch of the superficial temporal artery, and the superior auricular artery. And about the nerve supply, it is supplied by the greater auricular nerve, lesser occipital nerve, auriculotemporal nerve, and auricular branch of the vagus nerve, which is also known as the Arnold's nerve. And it got some fibers from the facial nerve also. So here we can see the same blood supply which we were seeing in the last slide. The external auditory canal from the concha to the tympanic membrane. This is 2.4 centimeters long. It has got two parts, the outer cartilaginous part and an inner bony part. So the cartilaginous part is outer uh, one third of the external auditory canal. It is 8 millimeter in length. It has got two deficiencies. It is known as the fissures of Santorini. The bony part is the inner two-third of the external auditory canal, and it is 16 millimeter long. It has got a isthmus near the tympanic membrane around 3 to 4 millimeters lateral to the tympanic membrane. It has got an anterior recess just lateral to the tympanic membrane in the anterior-inferior aspect, the foramina of Laschke, and a tympanic sulcus also. So we come to the next slide. There is some problem with the slide share. Yes. Now we come to the tympanic membrane. The medial end of the external auditory canal and of the tympanic membrane. There is a partition between the external and the middle ear. It is obliquely set. It forms an angle of 55 degrees to the horizontal. It is about a 9 to 10 millimeters tall, 8 to 9 millimeters wide, and a 0.1 millimeter thick. It has got two parts. One is pars tensa and another is pars flaccida, which is also called as the shrapnel's membrane. It has got three layers: outer epithelial layer, the middle fibrous layer, and an inner mucosal layer. It forms by all the three ectoderm, endoderm, and mesoderm, and this all three layers are made up of the respective germ layers. So pars tensa, it has got an annulus all around. It has got an umbo where the hinder of malleus is attached. It can be divided into the four quadrants. If from the umbo, if we put a vertical as well as the horizontal line, divides into this tympanic pars tensa into four quadrants: the anterior superior, anterior inferior, and a posterior superior and posterior inferior quadrant. It has got in the anterior inferior quadrant, it has got a cone of light. It is because the reflection of the light thrown through the headlamps, uh, and it is formed because of the angulation of the tympanic membrane to the horizontal. The pars flaccida, it is also called as the shrapnel's membrane, and it has got anterior malleolar fold and a posterior malleolar fold. The nerve supply of the tympanic membrane is auriculotemporal nerve. It supplies the anterior half of the lateral surface. The auricular branch of the vagus nerve, it supplies the posterior half of the lateral surface, and the branch of the tympanic branch of the ninth cranial nerve, which is also known as the Jacobson's nerve, which supplies the medial surface of the tympanic membrane. Now we come to the anatomy of the middle ear. The middle ear, what is middle ear cleft? Middle ear cleft is found by the middle ear itself. It is the tympanic cavity, hiatus, antrum, and the mastoid air cell. The middle ear or the tympanic cavity, it is irregular air-filled space within the temporal bone between tympanic membrane laterally and the osseous labyrinth medially, containing the auditory ossicles, intratympanic muscles. They have got the bones, muscles, hair. Middle ear has got three components. We can divide this thing into the three parts. The upper part is the epitympanum, which is also known as the attic, lies above the level of the medullary folds. The hypotympanum, it lies below the level of the tympanic sulcus, and the mesotympanum, which lies opposite the pars tensa. The middle ear cleft is we call the hole from the eustachian tube up to the mastoid air cells, which contain the middle ear cavity also, hiatus, antrum, and all this whole thing is called the middle ear cleft. Middle ear cavity. Now we come to the specific per se middle ear cavity. It has got the six walls as of a matchbox. It has got a lateral wall, medial wall, anterior and posterior walls, and a roof and a floor. It has got six surfaces, like this I already told you. The roof is formed by the tegment tympani. The floor is a thin plate of the bone separating the hypotympanum from the dome of the jugular bulb. The anterior wall is a thin plate of bone. It separates from the internal carotid artery. And this anterior wall has got two openings. One is the lower one, and it is for the eustachian tube, and the upper one for the canal for the tensor tympani muscle. The posterior wall lies close to the mastoid air cell and has got the following structure: the hiatus, the fossa incutis, pyramid, and a facial recess. The lateral wall has got a scutum or the lateral attic wall, bony wall, and a tympanic membrane. Tympanic membrane from inside, it is very thin. It is forms the boundary between the outer and the middle ear. It vibrates in response to the sound waves. It changes acoustical energy into the mechanical energy as the sound waves comes and hits the tympanic membrane. It vibrates, and the sound energy is converted into the mechanical energy. This is the scientific name of the medial wall. The medial wall separates the tympanic cavity from the middle ear. It has got the promontory, oval window, round window, subiculum ponticulum, canal for the facial nerve, and a processus cochleariformis, and the sinus tympani. The content of the tympanic cavity, they are the ossicles, three ossicles, they are the major malleus, incus, and stapes. Intratympanic muscles are tensor tympani and stapedius muscle, the chorda tympani and the tympanic plexus. Now we come to the ossicles of the middle ear. The first and the largest ossicle is the malleus, that is head, got and a head, neck, handle, and the lateral and anterior process of the malleus. The head and neck of the malleus lies in the attic, where the manubrium lies embedded in the fibrous layer of the tympanic membrane, and the lateral process forms a projection and attached to the anterior and posterior malleolar folds. Incus. Now it has got a body, short process, and a long process. The body and a short process lies in the attic, where the long process hangs vertically and attaches to the head of the stapes. Uh, Short process of the step incus lies in the fossa inferior. The Now we come to the stapes, the third and the smallest bone of our body. It has got a head, neck, anterior posterior crura, and a foot plate. The foot plate is held in the oval window by the annular ligaments. This is the actual joints in the ossicle, the malleus, incus, and the stapes. The eustachian tube. It is the meaning of eustachian tube is the equalizer. It maintains the air pressure in the middle ear as well as in the nasopharynx and the outer ear. It is a mucus lined connects the middle ear cavity to the nasopharynx. It equalizes the air pressure in the middle ear. Normally, it is closed and opens under certain conditions only. It may allow a pathway for the infection from the nose. Whenever there is a infection in the nose, especially in young children, it may travel through the eustachian tube into the middle ear. The children are more commonly got the ear infections from the upper respiratory tract infections because the eustachian tube is much wider and shorter and straight in children as compared to the adults. Now we come to the intratympanic muscles. First is the tensor tympani muscle. It attaches to the neck of the malleus. It tenses the tympanic membrane derived from the first arch and supplied by the mandibular nerve. The stapedius. It attaches the neck of the stapes, helps to dampen the loud sound and protects the inner ear from exposure to the loud sound and noise-induced trauma. It is derived from the second arch and it is supplied by the branch of the facial nerve. Welcome to tympanic plexus. Tympanic plexus lies on the promontory and it is formed by the tympanic branch of the glossopharyngeal nerve and also got the sympathetic fibers from the plexus around the internal carotid artery. The mainly it supplies the medial surface of the tympanic membrane, the whole tympanic cavity, mastoid air cells, and a bony eustachian tube. It carries secretomotor fibers for the parotid glands also. The cauda tympani nerve. It is a branch of the facial nerve that enters the middle ear through the posterior canaliculus, runs on the medial surface of the tympanic membrane, especially between the handle of malleus and the long process of the incus. It carries taste sensations from the anterior two-thirds of the tongue. It also carries the secretomotor fibers to the submaxillary and the sublingual salivary glands. It is now come to the blood supply of the middle ear. The anterior tympanic branch of the maxillary artery it supplies the tympanic membrane. The stylomastoid branch of the posterior auricular artery supplies the middle ear and the mastoid air cell. The minor vessels, the petrosal branch of the middle meningeal artery, subtympanic branch of the middle meningeal artery, the branch of the artery of the pterygoid canal, and the tympanic branch of the internal carotid artery. They also supply the middle ear. And the blood from its drain into the pterygoid venous plexus and superior petrosal veins. Thank you so much for your patient listening. I hope you had an idea about the basic anatomy of the external and a middle ear. And in the next lecture, we'll be discussing about the anatomy of the inner ear. And after that, we'll just include and discuss about the clinical aspects of the ear anatomy, of the external and the middle and the inner ear also. Thank you so much.